Thank you, Dr. Grillo Lopez, Antonio. Congratulations to all our fellow cancer warriors, ladies and gentlemen. It's very special to be introduced by a longtime friend who has work has helped so many patients, many in this room, and also my father who had lymphoma and is now 93, and my mother who had pemphigus 92, and they're all alive because of your work and doing very well. Thank you, Antonio. My patients, my colleagues, my wife Ann, and I thank you for this Hope Fund's honor. It's always been a group effort. I'm honored and humbled to accept on behalf of our team. I'd like to briefly cover 6 lessons learned from practicing on medical oncology for 41 years. Lesson number 1, when you go in to see a patient, a person, they deserve your undivided attention. Observe and listen to them. They will always tell you what's wrong. When facing a difficult decision in their care, don't fret about it too much. Just ask them what they want to do. If it's right for them, then it's the right thing to do. Lesson number 2, there's always something that you can do to help. Careful listening, maybe push of a wheelchair, a cab fare home, but always the truth. As the old folk saying goes, to cure sometimes, to relieve often, to comfort always. Lesson number 3, schedule a return appointment. If you don't show enough hope to schedule a return appointment, what kind of message is that? Will your patient have any hope at all? People's courage and grit, I've learned over 41 years, will constantly surprise you. Ask some of our patients who have been cured when they're the first ones receiving a brand new anti-cancer agent, first in man. Lesson number 4, in advising young men and women deciding to have a family, tell them that they should have daughters. That's because even when you're old and drooling in the rocking chair in a nursing home, your daughters will always be there with you. They love you no matter what. Ann and I have had 2 daughters, so we have a spare, just in case. Lesson number 5, it's taken me 41 years to learn, it's the science. When I started doing initial phase 1 clinical trials in '79, Antonio and I, only 1 out of every 17 new anti-cancer agents ever made it through approval. Now it's more like 1 out of every 2. So please, Hope Funds, keep supporting the science. It's what's improving early detection and treatment and survival. Lesson number 6, spend time in teaching the next generation. Invest your time, invest in their new ideas, and as the Hope Fund does, invest in them. Remember, the next generation will be taking care of you and I. We want them to be the very best. And I have added a lesson number 7. You can improve the survival for patients with advanced pancreatic cancer. It's the science and it's the caring. Thank you very much for this honor.